name. I'm Dr.
Yeah, yeah.
Harshita Rajput, and I'm doing my postgraduate MD Psychiatry from IMS in some hospital, Bhubaneswar. My rank was 30K, and I always wanted to take psychiatry. Not because I had a lot of exposure or anything like that. It just when I was in internship, I used to be fairly confident about other branches when I used to go into their rotations. I was able to get at least the hang of the ailments of the patient. Okay, okay, what's happening with them? If I'll go and read about it, I'll get something. But psychiatry per se, in those 15 days of OPD, I was so clueless and so intrigued because of that, and I figured out that most of the medicos are. We have studied for 4.5 years. We have given the exam. We finally call ourselves doctors, but we have no clue what psychiatry actually is. When I saw the patient, it was very intriguing for me. I have no idea how to approach them, what to ask, what not to ask. It was so that pulled me. Then I looked about, and my parents were were pressurizing me towards gynecology and medicine.
Hmm.
So I was sure that I'm not going to take it, but just because the stigma is always there in non-medico families about certain branches. So just to give them their peace of mind, I worked in government hospitals in Delhi in both the branches. And then I was sure not this. And then they were convinced later on that, okay, fine, you take psychiatry. And I landed here.
Oh my
Yeah.
God. It's been a struggle for you to take psychiatry, actually. Like you've proved them wrong.
Yeah,
Like,
it was. Yeah, definitely it was. Yeah, I still listen sometimes. They still don't know what I do actually. My parents, I have no clue about medicine in general. They are very
hmm.
far from the entire scene, so they don't have any idea. And when it comes to psychiatry, they have never seen one before. They
Yeah.
don't know a single psychiatrist. So they did not know what I was going for. And I'm glad that they were able to put some trust in me that I'll be able to do something good with it.
Right. Like, ma'am, for you, it's been 2 years, right? So how has it been so far? You've almost just 1 year left. And like, what is your daily routine
Few
like?
months, bro. Few months.
Yeah. Right. So like, how's
Counting
your
days.
like you can actually answer this. How has first year, second year been different? Like, how was life in first year and how is life right now?
It's a difference of day and night, honestly, just in every sense.
Mm-hmm.
Psychiatry as a branch have, I believe, I talk to many people, senior faculties and my fellow PGs and my juniors. It have a very weird plateau, learning curve. Within 4 to 6 months, you believe that you learn very quickly. You get to grasp things which are very practical. You start to know what are you approaching, how to talk and all that. But then there is this very there's this plateau when you don't get to learn anything. After 6 7 months you feel like that's it, this is what psychiatry is, and I don't think you will be just thought about drugs you'll get to know, and after that there's nothing much. But that happens when you're not able to read much. In other branches,
Mm-hmm.
it's not like that. It's very linear curve. In psychiatry, it's not like that. In first year, you don't get to read much. You hit that plateau. But in second year, then you get the time. You are able, you get this privilege to choose your cases, your duties on your time, on your good time. And then you read. Then that plateau breaks. And then actually you fall in love with the branch. Before that, it's, I believe, what I felt till first year, it was a hunch. Okay, I like it. I like to listen to people. I like to listen to their ailment. Oh my God, people are going through so much pain. It feels so personal and still so distant at the same time. So it's more on a sociology level, but actual what the branch is, what the core is, and how it's a real science, how you can approach it from different angles, from philanthropic or from psychology point of view or from a molecular biologist point of view. It's a real science, and you get to know that after your second year, like in your second year, when you read those textbooks, when you read every scientist's actual point of view. And then, because as me as a person, I was never much of a big on reading. I was more in practical learning, but After my second year, I love reading now. I love what psychiatry have to offer in terms of academics.
And so yeah, like you want to say there's workload, or maybe you get to choose your duties, like kind of in second year, so you get time to
Yeah.
study. Okay.
Yeah, you get time to study, plus understand things also. Before that,
Yeah.
you cannot understand all that. You see patient and you actually see, oh my God, yeah, that's what happened with this patient. That's what you have the reference.
Right.
By the you collected those reference in those 1 year, and then you can put them on. It's not like other branches. It's definitely not like other branches because they are dealing with the lab tests and they have that references from day one. You don't have that references from day one. You collect those references entire 1 year, and you follow up your patients. That's the best part about this branch. There is no instant gratification when you see your patients assimilating into the society by your step by step approach.
Right.
That's what is giving you the work satisfaction what you were looking for in the
Mm-hmm.
branch.
Oh, yeah, right. So now, like talking about your college, like you from Delhi and you're here in Bhubaneswar right now. So
Yeah.
why did you choose this particular college? And if you remember, like at which number did you put this college in your choice list? Like if you remember.
Yeah, yeah. Given my rank, I did not have many options. See,
Mm.
I knew that there's no point for me choosing GMCs. So I was looking for Manipal. I could have
Mm.
gotten there, but I felt that it will be my UG is from Karnataka as well. And I stayed there
Mm.
for 5 years and I could not learn Kannada. So I knew that I won't be able to in these 3 years, and I could not risk it because psychiatry is all about talking. So I thought that I wanted to be in a city which have more options of where you get a more colossal or more cosmopolitan societies there. You can have some Hindi speaking people, or at
Mm-hmm.
least if they're not Hindi speaking, it's not their first language, at least it's their second language, third language, like that. But and moreover, ODI is very easy, which I got to know after coming here. So now
Oh.
I'm proficient in the language, and it's easier. And I'm sure it would not have been if I would have taken Manipal. So that's why my first choice still was Manipal, but then I, in my second round, changed it to IMS after talking to my counselor, who told me that it's just that you're paying money for a GMC, but you get patient load more than most of the GMCs here. So
Mm.
I got in.
Yeah. Like how about the work schedule, the duties, the workload, and how the leaves and toxicity, how is it there in your college?
We have six PGs in each year here, and we have 60 bedded ward. So it's mostly per day OPDs like 230, 400. It ranges
Mm.
in that. So it's huge. So in first year, it's very, very hectic. You don't get a breather there. But after second year, you start to get bit time off from the IPDs. You can focus more on the OPD, and you have more liberty there. Emergency duties are there. You get a lot of calls in the emergency duties, like some
Mm.
10 to 12 calls. And I used to get emergency, like 24-hour calls used to be in first year around 2 to 3 times a week because people are less.
Yeah.
So yeah, first year was very hectic. And for my batch specifically, first year was for 1.5 year almost. So it was very hectic. But second year, I'm not complaining. I got to read much in second year, and you get time for yourself, and you can choose as per your needs. So yeah, but workload is pretty much like it's not like when you take the branch that it'll be chill. It's not as per chill in
Mm-hmm.
terms of work-life balance. First year is there's no work-life balance in first year.
And like the toxicity, like that's what everybody wants to know, how toxic that particular college is.
I won't say it's toxic. See, if you come with certain mindset, at least some heads up with when you enter residency, it's not going to be a cakewalk for sure.
Mm-hmm.
In my college, the problem is there's no diversity. It's all male faculty there. Like there are 13 faculties, and everybody is a guy. So the lack of diversity is there. So everybody won't be able to understand a Gen Z metropolitan kid. The friction will be there for sure. But people are they're from all the renowned institutions from NIMHANS to CIP to everywhere. So you can reap out good if you are actually interested. And
Hmm.
nobody holds on a grudge on you. Nobody tries to go out of the way to make your life difficult. It's not like that. There is no plotting and planning. It's just they are the people from that place where they used to feel that hustle is actually how the way of residency should be, and they don't believe in our ways of doing things. So there's the regular friction comes, but nothing much, manageable. If you find your tribe, your
Right.
venting out system, then you'll survive.
Okay. That's right. Like, what are the pros and cons of taking psychiatry and IMS, SUM?
Uh, Pros, I think pros is that only that even though it's a private institution, you get exposure just like any
Yes,
normal
yes.
GMC. Um, it's a general hospital, so the consultation license is extensive as per day footfall of the hospital is around 4K. So it's huge. Consultation license is huge. We get day ward calls, bedside calls like 20 to 30 per day. So it's massive. So you get to learn everything, which I think the con is lack of clinical psychology training, I believe. You have to figure that out by yourself because as a psychiatrist, we're so because of the patient load again, that's a double-edged sword. We don't get the time to go and sit with the psychologists. We try to just,
Mm-hmm.
uh, you know, scoot our way out of it somehow
Right.
because we feel the psychiatry part is more important for us. For us, it's more important to look our IPD and to look for our, OPD. So we don't. I have not personally gotten any psychology training. I'll be looking for other certification courses and figuring that out
Right.
myself. But
And I think plus you get so exhausted doing the workup, you don't feel
yeah,
like counseling them again. You feel like you spent so much
exactly.
time, like, right.
True,
And
true,
uh,
true.
and I think like ending it with like same question, like what are the stigma, the challenges you faced? You've talked about it actually, but do you still think there are any stigma, the challenges you still face? Are your parents satisfied now? How are they? Like what is their
Yeah,
reaction?
they are. They just want us to be happy, right? So they are fine. They just
Hmm.
don't know what's ahead for me in future. So that's their concern, and I get it.
Yeah.
But the stigma is melting away in the real time, to be very honest. I see. But what I am very intrigued about is that the stigma which persists in the educated class of about psychiatry is that they think once they have entered a psychiatrist's office, their problems will melt away like this. That is also one kind of a stigma.
Hmm.
They don't believe that it's altogether a lot of work. You have
Hmm.
to be adherent to the system and you have to go through a lot of work. It's not magic like that. So that is one also another new kind of stigma emerging. But the older kind of stigma, I believe, it's melting away, but it's still there and it's going to be there for a long time. But
Right.
yeah, we are on the positive track. Uh, particularly the college I am in, it caters to the more rural class of the people and the kind of patients I see. I'm intrigued every day. Oh my God, how they came to the psychiatrist first. They have not gone to a faith healer.
Hmm.
So it's good, but again, that part, the faith healer part, and people not considering it any science, a hoax, or something like that, it's still there. And specifically, you get that from a lot of coming from a general hospital. You get that a lot from other specialities.
Yeah.
They literally just give you a call because they don't want to talk to the patient. They think you will come and you'll just pull out your magic wand and patient will start. I have literally received calls because to take their history. They did not want to take the history. So to get their history, I have received the call. So yeah, that's there. But let's just focus on the positive side. It is
Yeah.
going
Yeah.
in the positive direction, I feel, because somehow due to the social media and the awareness and the younger generation of the psychiatrists who doesn't believe in just sitting in the cabin and just stewing in their soup, they're
Right.
going out and actually creating some positive impact like you guys. So yeah, that's it.
Yeah. And like lastly, like what would you say to somebody who's considering taking psychiatry, but still they're not really sure? Like,
Yeah, The questions I get on my DMs is how much money psychiatrists make. That is the major question I get.
Yeah.
So that is, I think that is the most corrupt approach we have developed as medicos. And come on, the kind of money we are paying, I am paying. It comes very naturally. So, but I feel if you are actually concerned about the money part, you should not think about psychiatry or any other branch just for the money part. If you don't like the branch, there I have not seen a single doctor who does not like their branch and making money. So first like your branch and then think of making money. If you like the branch, you will make money. If it's not there, then there is no way in any parallel universe you're gonna make money.
Right.
But next thing, if you can tolerate listening, if you can be an active listener, you should take it. And things pan out. It's like any other medical branch. It's science, it's medicine. So if you put your midnight oil in it and you put your that days in, nights in, you'll start liking it. But the honest uh, effort should be there. I see
Right.
people who came with a very fancy approach in the branch. Okay, they'll be sitting and it'll be all chill and cool vibes. So they are very disappointed most of the time, and they have to see hebephrenic patients.
Mm.
So yeah, for them it's not it. They are not going to be happy. And if you want that immediate rush, if you like that, then please don't take the branch. People who like to have that, it does not give that immediate rush. It's a very slow burn branch.
Thank you for all the insight. And there's a few points probably I missed, and even Muskan missed. You covered them all. So thank you so much.
I'm glad to join.